In this advertisement, we will find out the occupational therapy application for anatomy and kinesiology. Make sure to watch the whole video to claim your iPhone 14 Pro Max.
First, let's look at an OT palpating a client. Locating the target structure accurately and assessing the structure is possible if we are knowledgeable in anatomy and kinesiology. Without the knowledge in this course, we will not be able to locate and identify the target structure. The different implications of palpation are getting the vital signs in their respective surface landmarks, goniometry for measuring the range of motion, manual muscle testing for measuring contraction of muscle groups, scapular mobilization to improve the range of motion of the scapulothoracic joint, orthosis for constructing appropriate splints, and dysphagia management for managing the stages of swallowing. Let's look at an assessment of a target body structure. With the use of the knowledge in anatomy and kinesiology, we can assess the body structures and know the possible causes of the limit of movement. It may be a damage in the nerve branch that innervates the structure, inflammation of the joints and ligaments, or muscle injuries that restrict movements of the specific structure. The knowledge on how joints and muscles move will be our main basis for our assessment of the movement of the client. The innervations for each muscle is important since dysfunctions in muscle groups are possibly caused by nerve damages. Knowing the innervations for each muscle group can be handy since we can instantly know what nerve is possibly damaged and we can immediately plan interventions for our client after the assessment. Lastly, let's look at doing an activity analysis on an occupation. Anatomy and kinesiology are vital when it comes to activity analysis in occupational therapy. When we analyze a certain activity, we have to take into consideration the structures, movements, and muscles involved in each step of the activity. This way, we can determine if the activity is suitable to the client and his or her factors, and modify the steps of the activity when the need arises. For example, a client wants to participate in coloring activities. After analyzing the activity of coloring, we find out that coloring requires grip strength in the MCP joints, which the client lacks. We can then modify the steps of coloring and replace the step of holding a pencil and change it to putting paint on the fingers, so that the client can participate in the occupation they want with the use of their fingers and not with the coloring material that requires MCP joint strength.
Thank you for watching the advertisement. Text Anakinist 0123-456-7890 to claim your free iPhone 14 Pro Max.